Have you ever wondered why stubborn wounds, relentless brain fog, or slow to heal tendons just won't cooperate no matter what you try? I'm Dr. David Haase at the MaxWell Clinic, and today I'm talking about one of my favorite healing tools, Hyperbaric Oxygen Therapy, or HBOT. Let's unpack what it is, why it works, and whether it might fit in your health journey. So first of all, what is actually happening inside of a hyperbaric chamber? Think of the hyperbaric oxygen chamber as a place you can go to get a warm, friendly, atmospheric hug. Inside the chamber, we slowly raise the pressure to roughly 1.2 to 1.4 times normal air pressure. Under that extra squeeze, you breathe almost 100% oxygen. And your blood plasma, not just the red cells, load up with extra oxygen. It's like turning every 2-lane oxygen road in your body into a 6-lane superhighway, delivering a healing flood of oxygen to even poorly perfused tissue. Extra oxygen fights infection, calms inflammation, and re-energizes tired mitochondria so you can produce more ATP, your cellular fuel. The FDA recognizes HBOT for 14 conditions: diabetic foot ulcers, radiation-damaged tissue, sudden hearing loss, carbon monoxide poisoning, decompression sickness, and more. Ongoing research keeps widening the circle, showing measurable improvements in post-concussion syndrome, certain neurodegenerative conditions like Alzheimer's disease, and long COVID brain fog after a structured series of therapies. So, who's most likely to feel the difference? Patients with stubborn wounds that refuse to close after surgery, folks coping with radiation-injured skin or soft tissue, and anyone still wrestling with concussion symptoms or long COVID brain fog. And last but not least, athletes and bio-optimizers eager to bounce back faster. HBOT isn't magic, but when applied for the right reason, it nudges biology in ways pills just can't. Let's go through some quick questions we often hear about HBOT. So what is hyperbaric oxygen therapy and how does it work? HBOT places you in a sealed chamber where the air pressure rises to roughly 1.3 to 1.4 times what you're breathing right now. Under that pressure, you inhale nearly 100% oxygen. Physics takes over. Higher pressure forces far more oxygen dissolved directly into your blood plasma, not just your red cells. With up to 10 to 15 times the normal oxygen load, even tissues starved by poor circulation finally get the fuel they need. That oxygen surplus fights infection, quiets inflammation, sparks new blood vessel growth, and recharges mitochondria so they can crank out ATP, the energy that every cell depends on. In short, HBOT turns oxygen from a trickle into a fire hose, aimed exactly where the healing has stalled. So which conditions are FDA approved for HBOT? 14 in total, including diabetic foot ulcers, chronic bone infections, radiation injuries, sudden hearing loss, carbon monoxide poisoning, and decompression sickness. Can HBOT help brain injuries or long COVID, even if those aren't FDA listed? Well, growing evidence says yes. Randomized trials show cognitive and neurologic gains after 40 to 80 treatments for post-concussion syndrome and long COVID brain fog. These uses are off-label, but increasingly supported by data. Is hyperbaric oxygen therapy safe? Well, for most people, yes. The most common side effect is temporary ear pressure, like during a plane going up. Serious events are extremely rare at the pressures we use. How long does an HBOT session last? Well, I'd like you to plan on 60 minutes under pressure, plus a few minutes to build the pressure up and let the pressure down. How many HBOT sessions will I need? Wound healing protocols often run 20 to 40 treatments. Neurological or long COVID programs may need 40 to 80. You can tailor the number to your goals and your response. When will you start to feel results? Some notice better sleep or less pain after just a handful of treatments. Tissue repair or cognitive gains typically appear midway through a program. Who should not do HBOT? Well, absolute contraindications included untreated pneumothorax and certain chemotherapy agents within the past week, COPD with carbon dioxide retention, uncontrolled fevers, or severe sinus issues may require special clearance. So what should I wear to an HBOT session? Well, that depends tremendously on the chamber. Our chambers, by utilizing pressure and 100% oxygen that the individual breathes in, allow the person to wear whatever they'd like, and we'd recommend that you wear something comfortable. In our chamber, you can take electronic devices and be able to listen to music or work on your projects, whatever they would be. However, there are chambers that will use 100% oxygen inside the entire chamber and go to very high pressures. In those chambers, you have to be certain that there's no zippers or metals and no battery-powered devices, because that amount of oxygen at high pressure is a bomb. And pure oxygen is highly flammable. So you always want to work with somebody who knows what they're doing with regard to hyperbaric oxygen, because this one issue is the greatest danger that hyperbaric oxygen can present. Does HBOT hurt? Nah, the treatment itself is painless. You'll feel pressure changes in your ears. Oftentimes just simple swallowing or bearing down will cause the ears to pop and relieve that temporary pressure, both as the pressure goes up and as the pressure comes down. Can children receive HBOT? Absolutely. Pediatric centers use HBOT for burns, traumatic brain injury, and cerebral palsy. We evaluate each child individually to adjust pressure and session length safety. Oftentimes, a parent will even get in the chamber with their child to ensure the child feels calm. Does HBOT help athletic recovery or performance? Many professional athletes use it to reduce soreness and speed tissue repair. Data is still emerging, but anecdotal recovery gains are strong, and the treatment is legal and drug-free. How does HBOT compare to other wound healing therapies? Well, unlike topical dressings or antibiotics, HBOT saturates tissue with oxygen from the inside out, sparking new blood vessel growth and collagen synthesis. It's typically layered with other wound care tools, not used instead of them. Oxygen is the oldest medicine on Earth, and pressure is the key that unlocks its full potential. If you're curious whether HBOT can help you turn a healing corner, give us a call. We're happy to answer questions and point you towards good science, whether you dive in with us or not. Until then, breathe easy and stay curious.